This short recording will review pharmacotherapy used for its cholinergic properties, otherwise known as rest and digest. Adrenergic and cholinergic pathways have many names. The adrenergic pathway is referred to as the sympathetic pathway, and the cholinergic pathway is referred to as the parasympathetic pathway. Sympathomimetic or anticholinergic refer to the adrenergic pathway, and parasympathomimetic and sympatholytic refer to the cholinergic pathway. A cholinergic response occurs when the nervous system receives a specific trigger initiating preganglionic neuron impulse. Acetylcholine is released by the preganglionic neuron binding with the nicotinic receptors of the postganglionic neuron. Finally, acetylcholine is released and will bind with the muscarinic receptors located in the target organs within the body. Nicotinic receptors are located within the neuronal synapses in the nervous system and neuromuscular junctions. There are several types of muscarinic receptors in the body located in the nervous system, cardiovascular system, the lungs, exocrine glands, gastrointestinal, and genitourinary systems. The alpha and beta receptors can have either an adrenergic or a cholinergic response depending on the agonist or antagonist response occurring. A cholinergic response results when the alpha-1, beta-1, and beta-2 receptor sites have an antagonist response and when the alpha-2 has an agonist response. Receptor sites for both the alpha-1 and beta-2 are in the cardiovascular system, lungs, muscles controlling the iris, the neurological system, ureter, bladder, and uterus. Alpha-2 receptors are in the heart, juxtaglomerular cells of the kidney, and nervous system. Beta-1 receptors are in the cardiovascular system. When any of these receptor sites experience an agonist or an antagonist effect, the mechanism of action of the drug and adverse effects will occur in the locations where the receptor sites are located. For example, a beta-2 blocker may be given for stage fright, but the drug will also affect the other body systems the beta-2 receptors are located, like the lungs, nervous system, pupil function, bladder, and uterus. This is one strategy which may help you remember the adverse effects of each drug category. The cholinergic pathway is referred to as the rest and digest response. With an agonist response on the cholinergic receptors, the following physiologic responses occur: pupil constriction, increased salivation, decreased cardiac output, increased peristalsis, bladder contraction, and urinary sphincter relaxation, leading to increased urinary retention. Starting with the alpha-1 antagonist medication group, the prototype drug is tamsulosin. The suffix of drugs in this category is OSIN. This drug group is primarily used to treat patients with benign prostatic hypertrophy, but also used for patients struggling with insomnia, post-traumatic stress disorder, and hypertension. The mechanism of action of the alpha-1 antagonist are that a cholinergic response is triggered. Therefore, the adverse effects will often be compounded cholinergic symptoms like hypotension, dizziness, or headache. The alpha-2 receptor is unique in that adrenergic neurotransmitters lead to a cholinergic response instead of an adrenergic response. The prototype drug in this category is clonidine with the common suffix of DINE. Alpha-2 agonists improve symptoms of ADHD, opiate or alcohol withdrawal symptoms, and chronic pain. Like the alpha-1 antagonists, the mechanism of action results in a cholinergic response, and adverse effects can include compounded cholinergic symptoms like bradycardia, hypotension, and sedation. Now for the beta blockers. Remember that beta-1 receptors are cardioselective, therefore only present in the cardiovascular system. Beta-2 receptors are not only located in the cardiovascular system, but in the pulmonary system as well. Beta blockers have a common suffix of OL. If the first letter starts with A through N, it is a beta-1 blocker. If the first letter starts with O through Z, it is a beta-2 blocker. Beta blockers are used to treat conditions like hypertension, tachycardia, or stage fright. The mechanism of action and adverse drug reactions include cholinergic effects like hypotension, bronchoconstriction, or bradycardia. Beta blockers can cause exacerbations in patients with chronic respiratory conditions like COPD or asthma, and disguise symptoms of hypoglycemia in patients with diabetes. Therefore, beta blockers should be avoided in these populations. Now you will have the opportunity to practice what you've learned by answering some practice questions. You will have 10 seconds to answer each question. If you need more than 10 seconds, you can pause the video once the question is read. Good luck! A parasympathomimetic drug would result in which of the following side effects? Select all that apply. Pupil dilation, salivation, insomnia, bradycardia, dizziness. Parasympathomimetic is another term used to represent the cholinergic pathway. Salivation, bradycardia, and dizziness can be physiologic outcomes when a cholinergic drug is given. In an agonist state, which of the receptor sites result in a cholinergic response? Select all that apply. Alpha 1, alpha 2, muscarinic, nicotinic. In an agonist state, a cholinergic response involves the alpha 2, muscarinic, and nicotinic receptors. A patient with ADHD arrives to an urgent care with sore throat. The patient's vital signs were within normal range except his heart rate measuring at 52 beats per minute. Which of the following medications would account for the abnormal findings? Tamsulosin, clonidine, propranolol, or prazosin? The alpha-1 antagonist drug clonidine has the side effect profile of bradycardia, sedation, or hypotension. This would provide possible cause for the patient's low heart rate of 52 beats per minute. Which of the following drugs are contraindicated in a patient with COPD? Propranolol, tamsulosin, metoprolol, labetalol. Beta-2 blockers have a possible side effect of bronchoconstriction, therefore should be avoided in patients with underlying pulmonary conditions like asthma or COPD. While beta-1 blockers are touted as cardioselective, these are typically avoided as well, particularly when there are alternative medications that can be used for common cardiovascular diseases. We hope that you enjoyed learning about cholinergic responses and pharmacotherapy. Good luck on your continued learning journey.